Hello, welcome back. Today we're going to be discussing infections. We've all heard about STIs, how terrible they are, how gross they are, and we've all heard about how much we don't want to get HIV or AIDS. But what does all this mean? A sexually transmitted disease is an infection that is transmitted through sexual contact that is caused by bacteria, viruses, or parasites. Although the list of possible infections goes on, today I have chosen to focus on chlamydia, gonorrhea, syphilis, the human papillomavirus or HPV, and HIV and AIDS. To begin with chlamydia, it is estimated that about 1.7 million people were infected in 2018, which equates to about 540 per 100,000 people. Of those, young women accounted for about 44% of the reported cases, but this does not mean that others are immune, and chlamydia occurs in both men and women and affects all age groups. Chlamydia is a small parasitic bacterium that acts as a virus, meaning it requires the biochemical mechanisms of another cell in order to reproduce. Luckily for us, it is one of the most commonly curable STDs. Chlamydia is easily spread and has the potential to do great damage, as it is hard to identify because it has no symptoms and can cause more serious health problems if left untreated. Briefly, the symptoms of chlamydia in women include abnormal vaginal discharge and odor, pain during intercourse, itching and burning in and around the vagina, and pain when urinating. Symptoms in men include a small amount of clear or cloudy discharge coming from the tip of the penis, painful urination, burning and itching around the opening of the penis, and pain and swelling around the testicles. You can decrease your chances of contracting chlamydia by using condoms consistently and correctly, limiting your number of sexual partners, and by avoiding douching. Some common risk factors include being sexually active under the age of 25, multiple sex partners within the last year, and a history of prior sexually transmitted infection. With anything comes potential complications, and those for chlamydia include pelvic inflammatory disease, which is an infection of the uterus and fallopian tubes that causes pelvic pain and fever, epididymis, which is inflammation of the coiled tube located beside each side of the testicles, which results in fever, scrotal pain, and swelling, and in some cases infertility caused by a scarring or obstruction in the fallopian tubes. Chlamydia can also be spread from mother to baby by pregnancy, labor, or nursing. Next, gonorrhea, aka the clap, is less common than chlamydia, with about 580,000 cases in 2018. This equates to about 179 people per 100,000. However, as many as half of these cases occur in young people between the ages of 15 and 24. Gonorrhea works by infecting the mucous membranes of the reproductive tracts, including the cervix, uterus, fallopian tubes, and the urethra in both men and women. Gonorrhea is unique to other common sexually transmitted infections in that it can also infect other mucous membranes, which include those of the mouth, throat, eyes, and rectum. It can be transmitted by any form of sexual contact with the penis, vagina, mouth, or anus of an infected partner. The thing is, both men and women are typically asymptomatic, but women may experience vaginal bleeding between periods or symptoms that can be mistaken for another bladder or vaginal infection. Men can experience a white, yellow, or green urethral discharge as well as dysuria. As I stated previously, gonorrhea can also infect the throat and the rectum. The pharyngeal infection may cause a sore throat, and the rectal infection may cause discharge, anal itching, or painful bowel movements. One can work to prevent gonorrhea by using condoms correctly and consistently. It is interesting to note that gonorrhea is one of the only sexually transmitted infections that is building an antimicrobial resistance, and it is becoming more difficult to complete a successful treatment. There aren't any outstanding risk factors to gonorrhea, but the diagnoses of women have increased steadily for several consecutive years. Common complications of gonorrhea can be permanent and should be taken seriously, as gonorrhea can easily go untreated because of its asymptomatic nature. To name a few, pelvic inflammatory disease, epididymis, and infertility in men in rare cases are all possible. If it's left untreated, it can also lead to disseminated gonococcal infection, which is a life-threatening blood infection. It is also possible to transmit the infection from mother to baby through the birth canal during delivery. Our next infection of discussion is syphilis, with the lowest infection rate of about 35 per 100,000 people, equating to 115,000 cases in 2018. There are multiple stages of syphilis, with each stage becoming more serious. To begin, syphilis is a bacterial infection and begins with a painless sore called a chancre. Syphilis is transmissible during oral, vaginal, or anal sex and occurs when there's direct contact with the chancre. Usually people experience their first symptoms after 21 days of the infection, but these symptoms can begin anywhere from 10 to 90 days after infection. Our primary stage is marked by a chancre, which is usually firm, round, and painless. It also usually forms where the syphilis enters the body. It's important to note, and this is how people progress to the secondary stage without even knowing, is that the chancre lasts 3 to 6 weeks and then heals regardless if the person is treated or not. If you don't find the chancre and it heals, the infection progresses to the secondary stage. This is when you get a skin rash and what we call mucous membrane lesions. The rash can develop where the chancre is healing, or you can get a large, raised, gray or white lesions that can develop in warmed, moist areas, such as your mouth, under your arms, or your groin. This is usually accompanied with fever, swollen lymph nodes, sore throat, hair loss, headaches, and muscle aches. Super important again, although I don't know how you wouldn't notice it at this point. The symptoms go away with or without treatment, but that does not mean the infection goes away. This is when the infected person either develops the latent stage of syphilis, which is marked by no symptoms, even though the person still has the infection, or the tertiary stage of syphilis, which can reappear 10 to 30 years after the initial infection, and can be fatal because it affects multiple organ systems, including the brain, heart, liver, and bones. So how do you prevent all this? First and foremost, use condoms consistently and correctly. It is also recommended to be cautious if you have a sore outside the area that is covered by the condom, as this can still allow transmission. As of 2018, the majority of cases occurred among gay, bisexual, or other men who have sex with men. But this doesn't mean that women are immune, and it is estimated that 1,300 cases in 2018 were congenital, meaning that it was passed from mother to child during birth. With most common complications of syphilis, it is in reference to the tertiary stage, but other complications can include meningitis, stroke, dementia, and heart disease. Our next STD of choice is going to be HPV, or human papillomavirus. It's a viral infection with more than 40 different types, and it can be passed through sexual contact. These 40 different types also mean that it's super common. Most sexually active people will get some variety in their lifetime, even if they only have a few sexual partners. Like most, it is spread through direct skin-to-skin contact, with genital HPV infections occurring through direct sexual contact, such as anal, oral, or vaginal sex. However, this doesn't mean that intercourse is required for transmission. Also, like other infections we talked about, most people have it and don't even know it, which is why it's so important to get tested regularly. What this also means is it's possible to contract it even if your partner doesn't have symptoms, and it's possible to have multiple types at once. This might sound scary, but some good news is that 90% of HPV infections go away on their own, but there's always a silver lining. And when they don't go away, they usually cause serious health problems. One symptom of one of the types of HPV causes genital warts or warts in the throat, and let's face it, nobody wants that. However, other types of HPV can cause cervical cancer or cancers of the genitals, head, neck, and throat. And these cancers caused by HPV don't show any symptoms until late stages of growth. It's important for everyone to be cautious in regards to HPV, but it is estimated that 80% of women will contract at least one type of HPV during their lifetime. Which leads me into a super unique thing about HPV. There's a vaccine. And I'm sure you heard of it if you don't already have it. Gardasil 9 protects against 9 different types of HPV that are known to be associated with cancer and genital warts. Common risk factors are general: a weakened immune system, have another type of STI, increased number of sexual partners, but one that stuck out to me was using an oral contraceptive over a long period of time. And we already talked about complications of getting HPV, such as cancer, but if you suffer from vaginal warts associated, it can make vaginal delivery difficult if you happen to become pregnant. Lastly, let's talk about HIV and AIDS. To begin, HIV causes AIDS and interferes with the body's ability to fight infection. There's also fewer than 200,000 cases per year. HIV, a human immunodeficiency virus, harms your immune system by destroying the white blood cells that fight infections. AIDS, or acquired immunodeficiency syndrome, is the final stage of HIV. Not everyone that gets HIV will develop AIDS. I'm sure we've all heard this before, but HIV can be transmitted through bodily fluids such as blood, semen, vaginal and rectal fluids, and breast milk, as well as through unprotected sex or by sharing drug needles. Women can also pass HIV to their children during pregnancy and childbirth. If you contract HIV, the first signs may appear as flu symptoms, with severe symptoms not appearing until months or years later. An acute HIV infection is stage 1 and is marked by fever, chills, rash, muscle aches, night sweats, sore throat, and mouth ulcers. Stage 2 is what we call clinical latency, or chronic HIV infection. This is when the virus multiplies throughout the body but at very low levels. Stage 3 is AIDS, which is marked by rapid weight loss, recurring fever, prolonged swelling of the lymph nodes in the armpits, groin, and neck, diarrhea that lasts more than a week, red, brown, pink, or purplish blotches on or under the skin of inside the mouth, nose, and eyelids, as well as memory loss, depression, and other neurological disorders. Women with HIV also commonly experience recurrent vaginal yeast infections, pelvic inflammatory disease, changes in their menstrual cycle, or HPV. So how do you prevent HIV? Well, never share needles with anyone, and like I've been saying, use condoms consistently and correctly. If you're in a relationship with someone who has HIV or you're at a very high risk for developing HIV, you can take a daily medicine called PrEP, or pre-exposure prophylaxis, to help prevent HIV. Potential risk factors for HIV include anal sex, which poses the highest risk of transmission, with the receptive partner having the higher risk. Vaginal sex has a lower risk of transmission, and oral sex carries little to no risk of transmission. Other complications to HIV other than AIDS includes chlamydia, gonorrhea, and hepatitis A, B, and C. So what is the takeaway from all this? First of all, get tested regularly. It's recommended to get screened every 3 to 12 months depending on your frequency of sexual activity, but the baseline should be once a year. Also, like I've been saying before, use condoms correctly and consistently, as that is the best defense to these infections in the day-to-day. And finally, for both men and women, get the Gardasil shot. Thank you.